A few months ago, in the midst of the coronavirus pandemic, an executive director of a small hospital in North Carolina was in financial distress and desperate to improve their bottom line. He needed immediate results and was open to any tangible cost reduction ideas. The future of the institution was in jeopardy. As a leader in your organization, you're faced with the pressure of being a superhero every day. You carry a lot of responsibility and you work hard to increase the impact of your facility. Even with all that you and your team do, you may be surprised to learn that many areas of expenses don't receive the attention needed. You are losing money you don't even know about. I'm Ed Cody, and I want to welcome you to this special interview with Denny, Director of Expense Management at Encompass Healthcare Data Solutions. Barry is exactly the person you want on your side to show you where your opportunities for saving money are, just like he did for this small North Carolina hospital, which he'll tell us more about later. Barry, we're so excited to talk with you today about managing expenses and what you call cost containment.
Thanks, Ed. It's great to be here, and I'm excited to dive right in. So, there are only two things that a healthcare facility can do to increase their, for example, let's assume your healthcare facility has a profit margin of around 20%. Well, that means each dollar saved is equivalent to $5 in revenue. So on average, the facilities that we work with save around $100,000 per year. So it would take $500,000 in new revenue to achieve the same impact on the bottom line. So that means $100,000 in annual savings would be equivalent to $500,000 in new yearly revenue. And over a 5-year period, this equates to $2.5 million. So, think about what you could do with the savings. Could you hire new employees, purchase capital equipment, software, raises, bonuses? This cost reduction just frees up money for so many things, all because you were able to manage your expenses better.
Thanks, Barry. Yeah, for over 20 years, you've been helping healthcare providers implement cost reduction strategies, and you've seen the huge impact this has on their bottom line. Is that right?
Absolutely, Ed.
In fact, you've developed your unique strategies for managing expenses while you were completing a degree in surgical technology. Tell us, what inspired you to do that?
Well, Ed, after serving in the Navy as a hospital corpsman for 5 years, I used the GI Bill, went to surgical tech school, became a surgical first assistant, then an orthopedic PA. And along the way, I pursued an advanced degree in surgical technology. And for my class project, I did a cost reduction project for the operating room at the hospital where I was assisting in surgery. And the reason I did that is it just drove me crazy to see all the inefficiencies and all the waste in the operating room. So I did my class project on cost reduction strategies for the operating room. I ended up sharing the strategies with the hospital administrator, and lo and behold, she implemented most of my project. So that was able to save the hospital a lot of money. So from this initial experience, I created a cost reduction service that is a no-risk, success-based model, meaning that my clients only pay us out of the savings that we help them achieve. So if there's no savings, there's no fees from me whatsoever.
Well, Barry, as we know, you've worked with many healthcare providers. Are there any common challenges that you've seen these providers consistently face?
Yes, after helping healthcare facilities reduce costs over the last 2 decades, there are some commonly overlooked savings opportunities that, to me, just leap off the page. So many facilities simply don't have the adequate resources and expertise to do the best job at reducing expenses. Healthcare leaders and staff are already, so overworked and stretched thin that the idea of taking on expense management to find areas of savings is just too overwhelming. my clients have repeatedly told me that I was able to achieve levels of savings for them that they never thought possible. And because Encompass operates on a success-based model, they only pay me a percentage of the actual verified savings. I always say to my clients, you don't know what you don't know. And if someone else has the expertise and experience to find savings opportunities, you're always better off working with them than trying to take on the project yourself. So I've got a wonderful example of this, the benefits of hiring a professional. So last year, I was grumbling about how much my CPA charged to do my taxes. So I was going to be smart and have my CPA do the taxes, but I was going to do them as well, you know, with some tax preparation software, and just make sure that the CPA was finding more than I could on my own. So I was humbled to find that the CPA, you know, of course, the CPA does hundreds of tax returns every year. They know the ins and outs and, you know, the laws and everything. So long story short, the CPA's results saved me thousands of dollars in taxes, and more than I could accomplish on my own. So, you know, it's good to hire a professional that specializes in a very focused area.
Thank you so much, Barry. You're got great experience, and thank you for sharing your knowledge with us. You know, folks, Barry's been doing this for over 20 years, and he's seen just about every method for reducing expenses. It's just incredible the stuff he finds when working with his clients. I mean, you know, 100,000 average and annual savings. You know, that's really, really super, because you work with clients of all sizes. You know, these facilities that you've been helping, I know, were hemorrhaging so much money that they didn't even know about it, and you were able to save them enormous amounts of money. Remember, folks, he only gets paid out of the actual savings that you receive, and he really becomes your partner in getting you the most savings possible, and that's awesome. If I were you, I would be scheduling a consultation with him today. So right now, you can go to unixa.com/Encompass. That's unixa.com/Encompass, ENCOMPASS, to schedule your short consultation and start achieving the savings for your facility. Barry, I think we're ready to move into some of the most frequently asked questions you get from your clients before you start working with them. I'd really like our audience to hear some of these, since they probably have some of the same questions. What are your three most frequently asked questions that you get?
Well, Ed, one of those frequently asked questions is, how can you reduce our expenses? We already have a GPO membership. And GPO memberships are one of the most misunderstood things out there. So I compare a GPO membership to a AAA auto club membership. So, you know, carrying that card around in your wallet or purse, that doesn't do anything to save you any money. It's not until you pull that out when you're reserving a hotel room or using any of the other services where there's a discount connected. So, you know, I wrote an article for a hospital publication a few years ago about the subject, GPO relationships. And I had a picture of Arnold Schwarzenegger and a picture of Mr. Skinnyverse. And the caption was, both of these guys are members of Gold's Gym, but which one is getting the benefits? So the same thing with GPOs. You know, it's not until someone like myself works behind the scenes to connect your vendors to those contracts. It's not until somebody does that work that you get any savings. So a GPO membership in itself does not save you one penny. It's not until someone connects the dots that you start saving. And also, as far as GPOs, it's not some magical thing that, you know, you're going to get good prices on everything. keep in mind that only about half of your medical supply purchases will even be on a GPO. For example, things like private labels with your medical distributors, PPE, exam gloves, bandages, paper products. These are private label products that are not on any GPO contracts. So that's where our benchmarking comes into play, because we know what those prices should be for those items that are not on any kind of a GPO contract. So another question that I hear a lot, at least initially when first talking to folks, is, we just don't have time for this project. And, everybody's got something going on. They've got a building project. They're hiring new doctors, new surgeons. There's always something, right? So people are surprised with this, but we can get 90% of the data that we need in about an hour of your staff's time. And this is just a list of vendors, an annual spend with each, and vendor logins with 3 or 4 of the vendors that we identify savings opportunities for. And lastly, a common comment that I hear is, we think we're doing a good job. Our sales rep says that we're getting a good deal. I sort of chuckle when I hear that. It's like the fox guarding the hen house. Of course, the sales rep's going to say that that you're getting the absolute best prices. And so how do you know that you're getting good prices, fair prices? And that's where I come in with our benchmarking to make sure that you are getting fair prices. So we do a free benchmarking analysis, and a combination of 2 different things occur. So one of the things that comes from our analysis is we confirm areas where you're doing great, where you're getting fair prices. And we're very, very careful to point all of those areas out. These prices are great, good job. And then we identify some areas where there are savings opportunities. So, I ask folks, where's the downside? We're either going to confirm where you're getting the great prices, and we're going to identify some savings along the way. So there's no downside. And by the way, I would say 90% of the strategies that we put in place for folks does not involve any change of vendor or product or service levels.
Right. Well, Barry, I've had the pleasure of seeing you at work for several years, and you've made a big difference with the providers you've worked for. And so many providers, perhaps many of you in our audience, are losing money in ways you don't know. But the solution to the problem doesn't have to be complicated or require extra energy from you or your staff. It's as simple as scheduling a consultation with Barry today and finding out where your opportunities for saving money are. Now, note this, Barry is also offering a $25,000 guarantee that if he cannot help you find at least this amount of savings, he'll write you a check for the difference. Now, Barry, before we go any further though, can you tell us how things are going with that North Carolina hospital that we talked about at the beginning?
Yeah, sure, Ed. So happy to. In a short time, we saved the North Carolina hospital around $100,000 per year, and we continue to look for more savings. And so the hospital executive director, he was relieved that we were able to implement great results so quickly. So it was a burden lifted off of him, and he had much less stress after we put some savings in place for them.
Gosh, yeah. Thank you for sharing that, and thank you again for your time today, Barry. It's been a real pleasure, and thank you to everyone watching. Once more, go to unixa.com/Encompass to continue the conversation about reducing your expenses so you can increase your bottom line. Thanks again.